Hi, my name is Brian Burke. As you may know, babies learn the basics of their primary language by the age of 6 months. During their first 12 months, they are listening to what is going on around them and interacting with their parents and family. By the age of 3, most typically developing children have basic communicative understanding in all areas. Some children who are either born with or obtain hearing loss can learn to communicate through oral language. Auditory verbal therapy is an early intervention treatment approach for children who have a mild to profound hearing loss that are fitted with hearing devices at an early age. Children who are deaf can also receive auditory verbal therapy if they are using an efficient hearing device, such as the cochlear implant. Auditory verbal therapy has been shown to be a highly effective habilitation method for children with cochlear implants because it focuses on the audition of sounds. Auditory verbal therapy can be taken in a hospital, a clinic, as private practice, or in school settings. Auditory verbal therapy emphasizes the development of listening and language through natural play, conversation, and daily routines, as well as structured therapy activities. It is crucial for the child to listen and to familiarize themselves with the correct pronunciation of different sounds in early phases of their life in order to understand that each sound has meaning. Things that contribute to effective treatment results are early detection of the hearing loss, the appropriate use of the fitted hearing device, such as loudness and the quality of the perceived sounds, one-on-one intervention with full parent and family involvement, the absence of visual signs and speech reading training in order to encourage the child to listen, the integration and interaction of the client with hearing peers, and ongoing diagnostic therapy. In each session, the therapist provides coaching and guidance for the parent and diagnostic assessment of the progress of the child. In my auditory verbal therapy plan, my client is a 4-year-old male who has had cochlear implants for 2.5 years. Because of the goal of the client is to be successful in future mainstream schooling, the focus of this therapy is to help the client listen to the appropriate phonemic sounds and vocabulary and intelligibly reproduce the same sounds in spontaneous speech. During sessions, I read basic everyday single-word vocabulary while soft noise is playing behind the dialogue. This exercises the client's ability to listen in a short distance with a low background noise. Some difficulties that might be disadvantageous to the success of the client's treatment might be the diagnosis or the implantation of the hearing device may have occurred too late in development, the child's own intelligence or other phonological disorder, the skills of the therapist, or lack of family participation in the client's treatment. The role of the family in early intervention is essential to establish a child's pre-verbal skills. It is also helpful to the parents and family to accept their child's hearing impairment. It's the parents and family who serve as the primary language models for their children. Auditory verbal therapy emphasizes the development of spoken language through early identification of hearing loss, optimal amplification through a device, and intensive speech therapy. Auditory rehabilitation helps hearing impaired children to overcome their handicap and become members of mainstream society. Thank you.